Hello, I'm Fiona Stanley, and what a wonderful celebration. I can't believe it's 35 years since Mooditj was established, and it is such a wonderful organisation, and it has just gone from strength to strength, even though over the years it's had lots of issues and challenges. But what an amazing organisation. I think it actually, and that's why Joan Winch got the Sasakawa Prize, I think it was the first Aboriginal health worker training program in the world, not just in Australia. So you should feel so proud tonight, really proud. I'd like to start at the beginning when I met Joan when I first came back from overseas in 1977, and I was committed to public health and Aboriginal children's health. And it was over in East Perth in Brown Avenue when the medical service there was before it became Derby Yerrigan. And I remember Joan had this home visiting bus, and she called it the Great White Hope, which was absolutely hilarious and wonderful. We had so much fun. But then around the working up to Mooditj, Joan actually did a study with us from PMH, but it was all Aboriginal births in the whole of the metropolitan area. And she and her team of Aboriginal health workers who were still, they hadn't graduated from Mooditj because it hadn't been set up, she followed these kids and visited the mothers for a year, for the whole first year of their lives. She organised this program. And the infant mortality rate, the number of children dying in the first year of life, dropped by 50% with the Aboriginal Visitors program. Isn't that just the most extraordinary and successful story? And I think that kind of vision that Joan had, absolutely devoted, particularly from my perspective, the health and well-being of mothers and their children, because the healthy start to life. She understood all of that. And I can tell you a little anecdote, because at that stage I was researching breastfeeding and mother's interaction with the child and the importance of a good family for child development and well-being. And Joan said to me, "Why are you researching that stuff? We've known this stuff for 50,000 years. I said, "Yes, but we've forgotten." White Australia had forgotten about how important this was for their children. So Aboriginal ways, that's what we need to do. So the setting up of Mooditj, I remember those early days, and the fact that the model was such a good model. Because if you wanted to have Aboriginal health workers out in the field and out in community, what you did, and this is Joan's vision, is you selected these people from all over the state. They didn't have to come for long periods of time to study at university or to be away from their communities because they find that very hard. So she said, no, we'll do these intensives, weeks of intensive work where you learn all the things. It was like doing a mini medical course, actually. It still is. And then you go back on community and work with the health services or the group and doing prevention. And as well as that, we had a whole lot of research that Joan encouraged. There was the Great Trachoma Survey, which was really important because everyone had thought after the surveys, I guess in the 1960s and 70s, that trachoma wasn't a problem. But the Mooditj health workers went out there and they sure found that it was. So those kind of things, the ear disease stuff, all of those things which are so crucial for the health and well-being of Aboriginal children and their parents and their grandparents, this was the kind of model that Joan had. So it was appropriate training, giving very good knowledge, all in an Aboriginal context, in a First Nations cultural context, and then, but being part of that community and going back to your community and being part of the family of Aboriginal people. Now, we did a study in about 1990, which I sent somebody out to the Eastern Goldfields, a paediatrician out to the Eastern Goldfields, to find out why Aboriginal people didn't use mainstream health services. And the results were, and she interviewed about 100 Aboriginal people, the results were shocking. The main reasons why Aboriginal people didn't use mainstream health services, even though they were good and they were local and they were there in the Eastern Goldfields, in Kalgoorlie and Boulder and so on, was the racism. Aboriginal people were not welcomed into these services. They were made to feel dirty, or they were made to feel unacceptable, or they were made to feel not good mothers, or all of these things, because there was no understanding of the culture and the kinships and all the things that were so fantastically important and so good for Aboriginal children and their families. So this is why Mooditj, this is why it's such an important organisation, because it is run by Aboriginal people, for Aboriginal people, for the health and well-being of Aboriginal people. So it's much more than just health work and health services. It is actually, and we now have all the research to show this, I wish we'd had it earlier, so we could have convinced the bloody politicians to fund these things more effectively, but they blame Aboriginal people for the services not working for them, and it's because they don't know how to implement the proper services. So there have been many people who've gone through Mooditj who have now gone on to influence those services and to be an absolutely powerful group of people to try and change them. Still a long way to go. The other thing I really remember with great joy was in 1988, quite early on in the history of Mooditj, we suddenly found out that Joan Winch had won the Nobel Prize for Community Health, the Sasakawa Prize, from the World Health Organization for the Mooditj project, the top community health prize in the world. Here in Western Australia, here, Joan Winch, you've no idea, we all went bananas. It was absolutely fantastic. And she had this wonderful way of involving medical people and nurses from the mainstream to come out and give lectures here. So this model was very good. There were no second-rate people teaching on Mooditj. Joan wouldn't have stood for that. So here was this very high-quality health service, now recognised by the WHO. Not recognised a lot in its own country. Really pisses me off, excuse the word, that these people aren't recognised so much in their own country. But how good was that? Mooditj, quite early in its year, 5 years old, there it is winning this international prize. So over the years, we have worked a lot with the Aboriginal health workers. I'm just trying to remember how many Mooditj graduates we've employed in our institute, but I think it must be getting up to between 50 and 60 now. Because, of course, we use them for all our research projects. We use them for the urban study I've told you about with Joan. We've used them out in the Eastern Goldfields with all of the otitis media studies, ear disease studies we did out there. We've used them as interviewers for the WA Aboriginal Child Health Survey, which is the only survey in Australia ever to have documented the extent and the impact of forced removals, the genocide that happened here, forced removal of children and families from country. And and I'd like to count them all up, and I'd like to name them all, and that might be some project I can do now I'm retired. But it's that source of incredible, trained, knowledgeable Aboriginal health workforce, and some of those people have gone on to do master's degrees and PhDs with us. So what a success story this has been. And I just want to end by sort of really almost aligning Joan Winch with people like Nelson Mandela. Because Joan's philosophy was that a society should be judged by the way it treats its most vulnerable people. And that is a direct quote from Nelson Mandela. So thank you so much for asking me to speak to you tonight. I'm incredibly sad that I can't be there, but my eldest grandson is turning 10 years old in Melbourne, and that's the reason. And that would be the only reason I wouldn't be there, to celebrate with you. So thank you. Have a wonderful night. Celebrate every bit of this wonderful organisation that has been so fantastic for West Australian Aboriginal health workers. Thank you.